Greetings, family. How you doing today? This is your guy, JC. I hope everyone is doing well today. I hope that you're taking care of yourself, you're staying healthy, you are prioritizing. And today's video is in reference to prioritizing. I would like to talk about field medicine or tactical medicine. We know that the emergency rooms are full with potential patients of this COVID-19, of this virus. We know that it's kind of dicey to get in to see certain physicians, certain doctors. So we have to have the ability to take care of ourselves. And this is where field medicine or tactical medicine come into play. I have my trauma kit in front of me. I'm going to tilt the camera so you can see it, so that I want you to get an idea of what you may need in order to maintain yourself until you're able to see a doctor or take care of it yourself. And then once the all clear order has been given, you can go get it checked out after that. Okay? You don't want to have to be solely dependent on someone else for your care. So I want you to look up taking a first aid basic lifesaver. I myself is first aid basic lifesaver certified, as well as combat lifesaver certified and TCCC certified. That means tactical combat casualty care. So I can patch somebody up that's been shot. I can patch somebody up that limb has been blown off until we can get them to a trauma care professional or center. All right, so what I'm going to do is I'm going to tilt the camera and show you some of the things that I have to give you an idea what you may need, if you don't already have it, to take care of yourself and your family until you can get to a professional, or well, you may not need one for that lesser injury. All right, so here we go. All right, I've already laid out a few things. This is my trauma bag. I am going to show some of the things that's already in it, and then these things on this side I'll put back in. All right, here I have a lot of gauze, a lot of bandages that you can use for wounds, your surface wounds, as well as your cuts, your various deep cuts. And here is a lot of gauze and a lot of wraps for that. And I keep them in the plastic so that they can stay sanitary. All right. I also have a blood pressure machine. All right. We know that high blood pressure is a huge thing in our community. So you have to keep up with your blood pressure, especially if you're losing blood. If there's an injury where you are losing blood, first thing you want to do is stop the bleeding. And then once you stop the bleeding, you stabilize the injured person. Once you stabilize them, you want to check the blood pressure. All right. Also, bandages. There's quite a few bandages, different sizes. Here we have various oxygen masks. All right. We have the nasal tube for oxygen in case there's some type of facial damage to the point to where the nose isn't prevalent, but the nasal cavities are still open or still there. And this is for with the nasal, with the nose still in place, and this is when the nose has been removed due to damage. All right. Here's a breathing respirator to help them breathe. You got a mask right here, as well as your actual pump. And again, I keep all of it sanitized and in place. Here we have your cold packs. Your various cold packs. All you have to do is crack them open, crack the chemicals open on the inside, and for cold compress. Again, several surgical sponges. Several of these. I have a small box of these, of the surgical sponges. If there's a lot of bleeding going on, you want to be able to help stop the bleeding. All right. Ammonia packs. Somebody get knocked out, you want to be able to bring them back without causing a lot of trauma to them. I know you shake them. You can use your knuckles on the upper chest. Here is purified water for wounds. We'll keep that in there. Here's your emergency survival blanket. Here is petroleum gauze dressing. So this is the gauze with the petroleum jelly on it, so that it'll help with covering some of the open wounds so they won't get infected. Triple antibiotic ointment. Make sure you have some of that in your kit. You're going to have your various gels. This is for burns. This is first aid antiseptic. This is going to help you clean your wounds. And this is a quick stop, a blood clotting agent that you can use to help stop the bleeding, especially if the bleeding is coming from a soft wound, some type or something near the artery. We have our triangular bandages, or your larger bandages. Here's your Ortho-Gel airway kit, in case you have to try to open someone's airway and it's blocked. You can use these various size tools to help open up the airway to get them breathing. Also, here's a stale multi dressing, trauma dressing. So I normally pack that right there. Stethoscope. You want to be able to hear the either the heartbeat or some type of blood flow within the injured person. Neck brace. Also have a IV pack. That's one of the skill sets that they taught us in field medicine. You got the IV pack. Here is the butterfly needle. Your gauze and bandages for that. This is also the tube that you use for the IV, especially if you're transporting them. Here's your scissors, flashlight, tweezers, CPR mask. These are your tape bandages. Alcohol swipes to clean your surfaces. Also, I added this boost oxygen. You know that when you come in contact with the paramedics, I have a couple of canisters. These canisters will allow you up to 101 second inhalations of 90% air. It's 95% air, that is. So this is what will happen if the the person that you are dealing with requires oxygen. We know that when the ambulance pull up, the first thing they do is give you an IV and oxygen. That normally takes care of and or stabilizes a lot of the injuries or situations or illnesses that we have until they can get you to the hospital. So I try to have the same thing available so that if something occurs with a family member or somebody around me, I'm able to assist. And I want you to be able to assist your family and yourself. So think about these things and seek the proper training for these things and make yourself prepared. I hope this has been helpful. Remember, pay attention or pay the consequences. You got to pay either way. So you might as well pay on the way in instead of on the way out, because you might not be able to afford it. Remember, peace or victory.